Well, hey there. I've got another bonus episode here for you. Another interview with Amanda from the Resume RX. And what we're talking about is red flags of interviewing, job search, and contracts, which is just so many good gems in here. So if you're new here, I'm Liz Rohr from Real World NP, and you're watching NP Practice Made Simple, the weekly videos to help save you time, frustration, and help you learn faster so you can take the best care of your patients. So without further ado, I'm going to share my interview with her. So welcome again, Amanda. I'm so happy to have
Hey,
you here. Do you want to introduce yourself if anyone doesn't know who you are?
sure. Hi, everyone. My name's Amanda Guarnieri. I am a nurse practitioner and I have been for the past 9 years or so. And I am the CEO of the Resume RX, which is a business where I help nurses and nurse practitioners specifically with career and resume strategy so that everyone can find their own fulfilling dream job.
So Amanda is coming back today to talk about red flags of the job search process, interviewing and contracts, which I'm really excited to talk about.
Yeah.
So we actually posted a question on Instagram for people to give some thoughts about it. But why don't we just jump right in? Do you want to start with job search red flags of job postings and what your thoughts
Yeah.
are on that?
Yeah, for sure. So there's definitely, you definitely want to be on the lookout when you are getting a feel of what's out there in terms of job positions. When you're looking at postings, there are a couple things that can stand out as, red flags. And so the first one, which is kind of funny, is if they spell nurse practitioner wrong. That's like a big pet peeve of mine, and I see it all the time. So if
Oh,
whoever's writing the job posting doesn't spell nurse practitioner correctly, I think that that's a little bit of a red flag. Or if they use the acronyms differently, like if they say that they're looking for an LPN or, sometimes people get LPN and NP confused. So
yeah, I do see
if,
that.
yeah, so that's kind of a red flag that they may not know exactly what you do, or they
Yeah,
may not be super familiar with the role. So
right.
that was one easy one. And
Yeah.
then the other thing is sometimes I see jobs that are posted and have like they'll list a salary that's really high compared to that area or compared to that specialty, or like really high for a new grad salary, and they'll say like all over the posting like new grads welcome, we train new grads, new grads, new grads. And while I love new grads finding jobs obviously, and I love practices that are willing to mentor and kind of cultivate new grads, I don't find the reputable practices really advertising in such a flashy way. So sometimes when I
Mm.
see that flashiness, whether it's like a flashy salary or a flashy, new grads plastered all over the job posting, I want to like dig deeper and read through the fine print of this job posting to see if there's anything shady. Like, does it look like a place that could be like treating pain patients with, I don't want to say pill mill because those aren't supposed to exist anymore, but like places that are pain clinics that just write lots of prescriptions all day and are, motivated by productivity, or are they seeing like a ton of work related injuries and they want you to just kind of churn out lots of patients all day. So those are kind of some trigger things that I've seen in job postings that I think should really kind of raise your flag, so to speak, to see if there's anything that's a little bit too good to be true.
Absolutely. I totally see that. I think I definitely see that in terms of like the new, like all in caps, multiple exclamation points, like new grads, come on in. So being careful about that, just like what does that actually mean? Absolutely. I'm trying to think if there's other red flags. Somebody posted on Instagram to me about um, saying that it was like a nurse position for looking for a nurse practitioner. So yeah, the same things along the same lines of like LVN versus nurse practitioner and like spelling it
Mm,
wrong or spelling it right, things like that. Yeah, I think that's what we were talking about, like the main kind of red flags for job postings. I mean, I think that when it comes to postings too, like we have talked about, like there's different, and like talking about the hidden job market, right? And what we've talked about before about like
yeah.
mainly people, new grads are looking at online job postings, and like I think we definitely see a lot of pain management and we see a lot of long-term acute care, And I think just being really careful about like, those are not necessarily all the jobs out there. Those are just in very high demand for a variety of reasons. But anyway, but we can move on to interviewing. There seems to be
Yeah.
a little bit more in interviewing and contracts. So what do you see as the red flags of interviewing?
Yeah, for sure. So I think that first of all, it's good if you haven't done a lot of interviews, it's good to know that there are questions that legally cannot be asked of you or that you have no
Mm,
obligation to answer,
mm,
which some people know, but maybe not everybody knows that. So I made a quick list that I'm going to read off, but um, you can't be asked in an interview or during the application process about your race, about your national origin, about your religion, your sex, your gender identity, your sexual orientation, whether or not you're pregnant or would like to be
mm.
pregnant. That's a big one that I feel like can get a little bit touchy that maybe employers try to like dance around. Like they might ask leading questions, asking you to tell them about yourself, but you don't
Like
have to
what? Like what would they say?
well, tell me what you like to do outside of work, or what brought you to the area,
Ooh.
or like open-ended questions that you could
Oh.
fill with like, oh, we moved here for my husband's job. Like that's fine to disclose, but you don't ever have to say your marital status, in
Mm.
terms of your tell me about your availability. You can just say your availability, but you might be tempted to say, oh, well, I have three
3 kids
kids,
at home.
you know and while I'm not saying that it's not okay to disclose that, because sometimes in the right scenario it's totally fine for you if you want to say that, but you don't ever have to, because you don't want to give anyone necessarily the opportunity to judge you, or if they're looking for a particular person and those factors don't match that. So that's like protected questions that they can't ask. They
And
also
that
can't
comes
ask
up
about
all the
your age.
time.
Yeah, for sure.
Interest, like, what do you like to do outside of work? Like everyone asks, like
Yeah,
every single interview I've been at, people ask me that. So
right. I mean, even if you were, 39 and a half weeks pregnant, they in an interview, they couldn't ask you if you were pregnant. You might want to address,
yes.
that in that interview, but legally they can't ask you that. They also can't ask you about your citizenship. So that was asked. One of my Instagram followers asked me, "Is it normal to ask for like the city of your birth and your driver's license information on a job application?" And that seems to be asking for your proof of citizenship, which I would say is not something that's normally asked, unless, of
Mm,
course, there's something that's required of the job. So, like if the job requires you to drive, they could ask for your proof of driver's license because that's a requirement for the position, but they couldn't necessarily ask you the city of your birth because that would imply your citizenship status.
that's such a good point.
Yeah.
Totally.
So it's tricky because in interviews, if you have an interview that's going well, chances are it's going to turn into this nice kind of conversational um, kind of dialogue, which is great. But just know that the amount that is shared is completely up to you as the applicant. The person interviewing you really can't and shouldn't lead you down a path to divulge more than what you are comfortable with.
It's so true. And it's so funny because like literally every single interview has asked me that. And one interview that I did, I actually consciously was trying not to talk about my daughter because I have a daughter, I have a toddler. And at the time, like I just talk about her constantly. And so like I tried really hard not to. And it was like very awkward when I accidentally mentioned like a doctor's appointment I had to take her to or something like that. And I don't know. I don't think that it was a thing. Like I don't think they were screaming me for that, but yeah, it is really interesting, like how much information you can disclose or accidentally disclose. If
Mhm.
I don't think it's necessarily like a huge deal. But yeah, other red flags you've kind of come across yourself or.
Yeah, I'm not sure if this is a red flag necessarily. Like, I'm not going to say that this is a, don't proceed with this employer, but I don't like when employers ask medical quiz questions, like textbook questions, like test questions. Um, I think it's totally fine when they ask for examples of situations and, things that you encountered. Tell me about how you handled something where you didn't know the answer, or, conflicts, that type of thing, leadership. But if they're going to ask you like, what's the dosing for this antibiotic for this disease?
Do they
Like,
really ask that? Have you been asked that
it,
before? That's all.
I have not personally ever been asked a medical question aside from an interview for a remote position. So I interviewed and started with a company that did, it was telehealth essentially. And it was kind of like concierge medicine. And there was a screening part of the interview. There was like an exam um, where there was multiple choice questions. That was kind of like test questions to make sure that you knew how to appropriately triage emergencies, that type of thing.
Mm,
Um, but it wasn't like in the face-to-face interview. I wasn't put on the spot.
yeah.
But I have heard of others in those scenarios, and I just have to roll my eyes because, you know, if you don't, the best quality to have is that you know what you know and you know what you don't know.
Yeah.
And, that's how I answer, that's how I recommend answering that question. If you're asked a question and you don't know the answer, which is very, very likely because they're probably trying to trip you up on something, you can just kind of, chuckle and say, oh, I'm way too nervous to know the answer to that right now, but I can tell you what I would do is I would consult this resource and, this is how I look up things that I don't know. And,
Yeah.
I would ask my mentor or my supervisor or whatever.
Mhm.
But yeah, it happens. And it just always, when I hear about it, it just rubs me the wrong way because that's not the point of the interview because you can learn, everyone can learn the book information and the guidelines and the
Mm,
memorizing. That's all stuff that anyone can learn. But in an interview, you're there to show kind of that stuff that you can't learn from a textbook, that
mhm,
there's not an exam for. And that's what a good employer should be looking for, should be getting a feel for how you work together and, your level of compassion and empathy and problem solving and critical thinking and all that kind of higher level stuff that's so far beyond,
mm.
whether or not a textbook answer to a protocol question.
Right, right. Oh, definitely. Yeah. So I mean, I don't think I've ever been quizzed in terms of like antibiotic dosing or anything. I have had some clinical questions. I think the most common one that I've gotten across multiple sites has to do with like what is an example of a difficult patient, um,
Sure.
which is kind of clinical and not really. I can't remember if any other clinical, like actual clinical judgment questions have come up,
Right.
but yeah, that's a great point. I mean, if they are quizzing you on just kind of like stuff you can look up, that's really kind of obnoxious.
Yeah,
It's not
I
very
agree.
nice.
And I actually really love that question of tell me about a time when you had a difficult patient because it
Mm,
gives you the opportunity to kind of explain your whole approach to how you go through that diagnostic process and that management
mm,
process. And it gives you the chance to kind of think out loud and show them how you would approach caring for your mutual patients. And I think that it can show a lot about you as a provider, especially as a new graduate, when you are probably, you know, not as confident in the assessment and plan side of the soap note. You can at least kind of talk through what you know about the process and how you would
mm,
approach things. And I think that can be really revealing to an employer about, how you would be as an employee.
yeah, absolutely. How to make a plan of care, have that whole video.
Yeah.
You haven't watched that one yet? Absolutely. Any other red flags that you've heard of from people working with people or just yourself or for interviews or
Yeah.
I think one other thing that came up was being addressed as toots in an interview.
Yeah. I
Respectful language is really important. I think understanding, I don't know, one other thing I thought of was like about like one interview I went for when I was a brand new grad was working as a new nurse practitioner with a bunch of physicians who had never worked with a nurse practitioner before. And that's not necessarily a red flag, but I think that it deserves more caution, right, in terms of approaching
Sure.
that kind of scenario, because at least for me, I felt like strong enough feet like under me or legs under me to feel like I could navigate that and explain not only what my role is, but how much support I needed and really have that confidence to kind of not necessarily push back, but be really direct about like, hey, this is what I know as a nurse practitioner. it's different than being a physician, and I need this amount of training and I need this schedule. Like I didn't necessarily have that knowledge right now, back then. So not necessarily
Yeah.
a red flag, but something to think about.
Yeah, for sure. I see, the thing that can happen if you're in situations like that can be great. If you're the first nurse practitioner in a practice and you have the opportunity to define the role, that can be really great. The trap that can happen is you can become a glorified scribe, particularly in like specialty practice, which happened to me in one scenario that I was eventually able to kind of navigate out of in that same practice. But if a physician thinks that your role is to go in there and collect the history and do the assessment and do like the
Yeah.
hands-on stuff in advance, come up with the plan, and then like go in together and he or she gets to sign the chart and bill for the visit and like call all the shots and they
Ultimately
call
make the
you.
ultimate decision. Yeah. Like
Yeah.
undermine kind of not everybody does that, but
Yeah.
that might sound really appealing to brand new grads, but like the point is that like you don't necessarily get control and you don't
Right.
get to decide, and you're doing all the hard work with supervision, but like it's limiting your scope of your practice
Yeah,
ultimately.
for sure. That ideally is how I would like an orientation period to be
Yeah.
for a new grad. And a way to kind of feel out what the NP role will look like at a practice, if it's not clear to you in an interview, is to directly ask, can you tell me about how this practice has kind of used nurse practitioners in the past, or can you tell me about typical workflow, or even better is getting the chance to shadow in the clinic. I think if you want the opportunity to shadow and for whatever reason there's like a hard that they don't want you to do that, then that would be a
Yeah,
red
that's a red
flag.
flag.
Yeah. And
Absolutely.
usually
I've
that
always
comes,
asked.
yeah, me
Sorry, go
too.
ahead.
No, I was just going to say, usually that comes like as part of the offer. Like you wouldn't necessarily get that just because you're interviewing. But once you move past that first interview, or if you're the only person interviewing, or there's the implication of an offer, that's when that conversation is important to say, if you're not 100% sure about whether or not you want to take the position, asking for, even just 2-4 hours of
Yeah.
fly on the wall shadowing
Yeah.
can be really revealing.
Absolutely. I'm so glad you recommend that too. I didn't do that the first time around, when I got my first NP job, but when I got my second, I asked every single person and I shadowed for like every single job. And it was great because you get to see all the different people, the feel, the vibe, just the flow. And like you can feel the energy when you get there, right? So like, is this a very happy workplace? Is this not a happy workplace?
Right.
Do they all collaborate? It's very different when
Yeah,
you're there in person.
for sure. Yes, agreed. The
Yeah.
other interview thought that I had was if they ask a lot of productivity questions, like if right off the bat they want to know how many patients you can see in an hour. I would
Especially
think
the
that
first interview.
yes, especially first interview, and especially as a new grad, because you're not going to know that. You may have a benchmark of what you saw per hour as a student, but that may not necessarily translate into your productivity as a provider. So any practice that seems kind of fixated on that um, should maybe be a red flag, and that would warrant either multiple interviews or a shadow experience for sure, because I wouldn't want the expectation to be that you are, a money making machine from day one. So that would be my concern with that. You don't want to be any practice's workhorse. You want to, of course, be a contributing member of the team and earn money for the practice. But you want to make
Be a
sure that
show
that practice
pony.
is supporting you. Yeah. No show ponies.
But yeah, I mean, I think the implication there for people who are not already working as nurse practitioners is that everybody is also all employers are ultimately concerned with your productivity of how many patients you see per hour and per day, because you are the revenue generating provider, meaning that someone who works at the front desk doesn't bring in any money to the clinic. Like you are the revenue bringing in person. And so the productivity numbers are super important when they look at financials, right, in the
Mm-hmm.
course of the year. But at the same time, like they need to know, like that implication is that they don't necessarily see a new grad as needing that like love and care and support of like a slower schedule and ramp up. They just want you to see 40 patients a day when you first walk in, and like, woo, don't recommend that. I
Yeah,
don't see
no.
40 patients a day. I see 20 and that's enough. So
Yeah, I think the only place where it's even realistic to see that many patients is in urgent care.
yeah,
And even still
Absolutely.
not like right out the gate, at least
Yeah,
after several months, if not a year or more.
absolutely. Absolutely. So yeah, let's move to interview or contract red flags. Go for it. What thoughts do you
Yeah.
have?
Let's see. So, speaking of productivity, that's a good segue. I think if a contract offers productivity only pay, that's
Mm,
concerning. So, there are a couple different ways that your pay can be structured as an NP. You can either be kind of flat salary, or you can be salary plus a productivity bonus structure, like a hybrid. Or there are some contracts that pay you only based on the money that you bill or that you bring in. So, basically that would be your paycheck is related to the number and the complexity of patients that you see. Which can sound really attractive, if you work harder you make more money, but then what happens when when there's a snowstorm and all your patients cancel, or if you want to go on vacation, or if there's a global pandemic? There are all these kind of situations that could happen that would completely wipe out your salary. So I like to see NPs taking a contract that has at least a reasonable, sustainable, livable base salary, um, and then pay productivity pay on top of that.
absolutely. Absolutely. And I feel like that seems pretty standard, at least what I've seen in primary care. So hopefully, but yeah, that's a really good tip because I think it's so overwhelming for people to look. First of all, when I was a brand new grad, I never signed a contract, and then now I'm signing a contract and I don't even know what it says. So that's a
Right.
really helpful tip. Any other red flags for contracts?
Yeah. I get a lot of questions about non-compete clauses and what that
Mm,
means, and is it okay to sign one? And um, I don't think that the existence of a non-compete is a red flag in and of itself, but what you want to do is read the details of that. So if they say that, so a non-compete clause is when um, your contract states that after the contract is over, um, you can't work within a certain mile radius of the practice. Um, and sometimes they define like the specialty. So they may say, for 2 years after our contract ends, regardless of why it ends, you can't work for any other primary care facility within 15 miles of this metro area. Like that's just an example of what it could be. And so what you want to look at is the termination. So if they say for any reason, that means whether or not you quit, whether you're fired, whether you're furloughed, whether you're laid off, whether the clinic closes, those would all be reasons that they could enforce that non-compete clause. So at the very minimum, I would recommend getting that reduced to if you're um, like terminated or if you resign. Um, and then you want to make sure that it's basically not wiping out all the places that you could potentially work in the area that you
right.
live. So you just want to look at that closely. There are a lot of nuanced details of that type of clause, but if that clause exists, you want to look at it and definitely feel permission to negotiate that.
Hmm. Yeah, like get rid of it maybe.
Yeah,
I
I
don't know
know.
if they even let
Yeah,
you,
best
but
case scenario is no thanks, I'm not going to sign that. Um, I
absolutely.
don't I don't think that I think that non-compete clauses are not very respectful.
Yeah.
Um, and I think that when you're entering this type of agreement, um, it should be a respectful agreement. And you're not anybody's nurse practitioner. You don't want anyone saying this is my nurse practitioner. You're not
Mm,
the property of anyone. You're not anyone's show pony. And along those same lines, like it is respectful to decide what's not a good fit for you and move on professionally. And it should be a two-way street. So I think that that type of language can potentially start things off on not such a great foot. Um, so hopefully they'll be open to that conversation
mm,
about either hopefully eliminating it completely, and if not, making the terms very, very um, in your favor, I guess.
Yeah, yeah. And actually, kind of going back to the paying, what you were saying about the different types of pay, productivity, I feel like in my experience, I've seen there being some sort of language about the expected productivity. Do you feel like that's pretty standard for nurse
Yeah,
practitioners contracts? To say like, oh,
yeah.
we expect eventually to see like 25 to 30 patients a day or whatever.
Yeah, I would love for new grads to have pretty explicit terms laid out, like this will be the length of your orientation period, and we will, ramp you up gradually to an expectation of X. And
Mm-hmm.
then I really love and I really encourage for new grads building in some sort of time period where you have the opportunity to have an evaluation within that first 3 to 6 months.
Mm,
Um, I don't necessarily think there needs to be a contract renegotiation at that point, but having a sit down meeting so that you can take a look at what your productivity has been and where it aligns with what is expected of you, or what they ideally want you to be at. Um, is smart, and it just kind of gives you the opportunity to sit down with the practice manager or the physician or NP who owns the practice and just make sure that everyone is happy with your work and that you're living up to expectations, and where you can improve and all that.
absolutely. And this actually reminds me of Amanda had a free class the other night, and hashtag not legal advice. I feel like we should bring
Right.
that in here because we are not lawyers and this is not legal
No.
advice, but just general thoughts about contracts.
Yes. Right. Yes. We're not lawyers. We don't
No,
play them on TV
on TV.
or YouTube.
Oh, cool. Well, any other contract and any other contract thoughts of red flags for people?
I would just really encourage people to make sure that things are clear. Like your hours should be clear. Your responsibilities should be clear. Whether or not you're on call should be clear.
Mm,
And like
such a good point.
when that is and how often that is. If there's any call time at all, it needs to be very explicit, like one on call weekend every quarter or something. Whatever it is needs to be that specific,
Mm,
because you don't want to end up having to take on a ridiculous amount of additional responsibility if someone else leaves the practice. And this can happen a lot in smaller practices. So making sure that that is just really clear, making sure that there's time off that's given to you, and that it's not, I've seen some contracts that say, you won't have any official time off. You'll just work around your vacation and make up your hours elsewhere in the month. This happens a lot for shift work contracts, so
mm,
emergency trauma service, that type of thing. Um, and they'll say, okay, you have your contract requirement is 15 shifts per month, 15 12-hour shifts, which is essentially 42 hours a week. Um, and it kind of sounds like, oh, well, if I just want to take a week off, I'll just move my shifts around it. Like that sounds attractive, but that's terrible. Like if you want, if you want to go on a week vacation, or if you want to go on a week and a half or 2 weeks vacation, you don't
you
want to be
just work
working
and work
five
and work and
12-hour
work.
shifts before you go. And when you come
And when
back,
you come back, as soon as you come back.
that's terrible. You're going to resent your vacation. So don't do
That's
that.
true. Don't do that. Definitely. Absolutely. Well, any other thoughts to share?
No, I think that rounds it out.
Awesome. Let them know if they're watching, if they don't know already, you have your class right now, and it actually closes tomorrow because this is going to go
Yes.
up tonight.
Yes, it
So
closes Wednesday, April 29th at midnight. Dream Job Roadmap for New Nurse Practitioners. It's an online program that is essentially meant to take you from commencement to contract. So we're talking about job search, interview mastery, job negotiation, contracts, all that good stuff. And I would love to have anyone who is interested. It's open until tomorrow night, and it will
absolutely.
likely reopen again in the summer to catch the next wave of new grads.
Awesome. Awesome. Yeah. So if you like this conversation, you have more questions, Amanda clearly knows a lot of stuff. So can definitely help you out. And I'm really excited. I'm really excited for it. So thank you so much for being
Of
with us
course, my
tonight.
pleasure. Thanks for
And
having me.
we'll talk again soon.
Yeah, thanks.
So that's it. We'd love to hear from you. What are some questions that you have about interviewing or contracts or job searches? We'd love to be able to connect the dots there for you. And if you want to take this further, especially in the step-by-step, making it super, super easy all the way from graduation into the first job and getting it sooner and interviewing with confidence and ease, definitely join Amanda for the Dream Job Roadmap for new nurse practitioners. She's worked really hard putting it together. It's super stellar. It's basically just everything you want to know. I'm inside of it as well. So I hope to see you there. Thank you so much for watching, and I'll see you soon.